can do the intro. I'll introduce myself and you.
Yep.
All right.
Okay. Here we go.
Hey everybody, This is Dr. Clark Schierle here, Director of Aesthetic Surgery for Northwestern Specialists in Plastic Surgery, along with Monika Chashinsky, one of our outstanding physician assistants. And today we're going to do a quick video on things that you may or may not have known about transaxillary breast augmentation. Fancy word, breast implants going in through the armpit. Did you know you can put breast implants in through the armpit? This is something that Monika and I have had the opportunity to do now that she's been with us for a little while. She's seen some, and she was just thinking that it's relatively unique.
Yep.
And she had some questions that thought that she has some questions, then you might have some questions. So let's do a video.
Yeah, sure. In terms of the consultation, a lot of patients come in and ask, which mechanism in terms of the incision is a better option. The most common is under the breast, so inframammary, versus, the transaxillary being another option. And they tend to ask me, which way is better? What would your answer be?
We really try to be fairly agnostic. I don't think one is better than the other. Like with pretty much every decision that we make in plastic surgery for our patients, we help our patients understand the pros and cons and help them balance those. Both myself and my partner, Dr. Fine, who I learned the technique from, we are both very well versed in the breast augmentation through the armpit approach. We've both written multiple book chapters on the topic. Dr. Fine has done it as a live instruction at our national meetings. And I've always thought it was a really neat trick. You get this nice natural breast augmentation. It's basically the identical surgical procedure. You're just going from the top down versus the bottom up.
Okay.
So we do try to present it to our patients as being a more or less equivalent choice. Then they can make the decision based on where do you want the scar.
Right.
So if you'd rather have a scar that's hidden in your armpit so that your breast has no scar on it, and that's how this is marketed sometimes. We see this out there as the no scar breast augmentation. It's not technically true, it's just a no scar on the breast. Then this is a great option. Some people are, though, going to be a little bit concerned that this incision in the armpit is maybe a little more public.
Right.
The inframammary incision is always going to be hidden by a bikini or a bra, whereas in the armpit, if the scar, and that's a big if the scar heals a little bit more noticeably, then potentially someone might see it if you're wearing a tank top and your arm is way up in the air. Right. Those are a lot of ifs, and it tends to be a very well hidden, very minimal scar, and that's why our patients love it.
In terms of pain, would you say there's any difference of pain?
No, we've in our experience, we've found that patients have a very similar recovery, very similar results when the procedure is done properly, and that's it's very important that you go to someone that has a lot of experience in this technique. I do upwards of 70% of my breast augmentations through the transaxillary approach.
Nice.
So it's not a rare thing that we only try once a year. I've written book chapters on it. We do the same dissection. The analogy I like to give patients is it's like parallel parking. It's easier to pull into a spot at the mall than to parallel park on the sidewalk. And but if you're a driving instructor, then you should know how to parallel park. Right. And so here
you're the driving instructor.
Exactly. Both Neil and I, we do a lot of teaching. We teach residents how to do this, and so we know how to do that safely and effectively. And we like being able to offer that choice to our patients.
Sure. In terms of the location of the implant, can you put the implant above the muscle or below the muscle, or what are the options for the transaxillary?
That's potentially a topic for a whole other video, but I'll suffice it to say our most common location for the implant is a little bit of both. We like to do what's called a dual plane or biplanar approach, where the implant is partially under the muscle, which helps to give a softer, more natural look to the upper part of the implant.
Nice.
But the lower part of the implant, the muscle is more released, which allows the implant to kind of have a more natural teardrop shape. And we are absolutely able to perform the exact same degree of dissection of the muscle and the breast tissue from the top down versus the bottom up. In some ways it's actually easier because we've got this camera. We use an endoscopic system that lets us see the anatomy on a big screen in the OR, and it's kind of like a video game. I grew up playing some video games, so I think
that's why he's good at it.
Why I gravitated towards it.
And then final question, in terms of sizing, is there a limitation on size? I know sizing is a very important part throughout the breast augmentation
The
process?
short answer is not really.
Okay.
The bigger it is, the harder it is to get in. That's true for any incision. We're always trying to make the smallest incision and struggle through the smallest incision. But just I think in the time that you've been with us, we've seen 750 cc's, 600 cc's, silicone through the axilla, through the armpit. No worries. I think if it's a less experienced surgeon, they might want to stick to the 200 to 300 cc range. But we have a wide range of experience. I've done up to the maximum size of implants, 800 cc's through the armpit. By the time you've made that incision, you're pretty much where you need to be, behind the muscle, and it's actually not as far as you think. So the dissection and the technique is relatively similar.
Cool.
It just takes some practice.
Yeah, practice makes perfect.
Awesome. Well, hopefully that was helpful to you. Hope you learned some things today. If you have any other questions about this procedure, it is one that we love to do. Please feel free to leave a comment below. We'll check those and respond as quickly as possible. Make sure to like and subscribe and click that bell for notifications so that you know when we post future content like this. Until next time, stay safe.
See ya.
See you soon.
Hey guys, thanks for watching our video. Make sure to subscribe, follow us on Instagram, Facebook, and Twitter, and check out our next video.